Hey, deserving listeners, I thought I would answer some emails from patrons and YouTube members. This email is from patron and YouTube member, annual middle tier patron, Madi from Arizona. They say, "Hi, Dr. Kirk. There is a guy in my friend group who has repeatedly been clinically diagnosed as a sociopath. He has reportedly put himself through a lot of therapy in order to not be an asshole, not my words. And by all indications, I can see he has succeeded. He is not an asshole. He's happily married. He has a stable job. He expresses empathy appropriately. If he hadn't made that comment about his diagnosis years after I was introduced to him, I wouldn't have noticed anything that would have made me wonder. He also went through a tremendous amount of abuse in childhood. How are people like him diagnosed, and what would this therapy have looked like? Can you have a case of psychopathy or sociopathy that goes into remission?" End of email. Yeah, interesting email. And I don't know what happened. I don't know the basis of the diagnosis. We also don't know what the real diagnosis was because we have a client who is reporting something. But if I were to take a guess, and in your longer email, you talked about how he actually used the word sociopath, not psychopath. And the term sociopathy and the term sociopath is used in a lot of different ways in our field. It's also possible that the clinician diagnosed him with psychopathy or antisocial, which are related terms or overlapping terms or synonymous in some circles, to sociopathy. It's possible that he was diagnosed with antisocial or psychopathy, and that the client, your friend, hears sociopath or even uses the word sociopath because that's a word that's often used by the lay public. I don't know. But so there's a couple answers I'll give. One is let's go with the thought experiment that this individual was diagnosed with psychopathy and antisocial, and that this individual actually has psychopathy, actually is irresponsibly diagnosed as having a lack of empathy and a tendency to not care about other people's feelings and that sort of thing. I've done whole deep dives on that, and I will do additional deep dives in the future. I've never done an official deep dive on psychopathy and antisocial, but that is hopefully going to be done this year. So let's assume that this individual lacks empathy and has other signs of antisocial personality. So you're wondering, well, is it possible to recover or to mask or to not be an asshole or something, or to have remission? And the answer is, yeah, absolutely. These are squishy labels. They're not something like cancer, for example. If you had cancer and you had a tumor, or you had the clinical markers. Sorry, I have constant allergies, wiping my nose. Then you would be able to see the cancer cells in one's body. You would use the treatment, and then you would reassess. And if you see through a sampling of biopsies or observations, there's no more cancer cells, or there's no more tumors or whatever, and there's no more symptoms, then you would conclude that there has been a remission, possibly because of the treatment. But when it comes to something like antisocial personality, these are what we call constructs, meaning that in the field we will construct an idea, a concept, a label, a set of criteria, and the criteria are also subjective. Now, a lot of people in my field will claim it is not subjective, it is objective, but it's obviously subjective. The notion of lacking empathy, where's the line, right? Whereas when you're trying to delineate between diamonds and charcoal, there are obvious differences. It's both carbon, but there are structural differences. I don't know the exact definition, but there are definitions, right? There are ways of delineating between diamonds and charcoal. There isn't a hard line between having psychopathy and not having psychopathy. So, and there's also not a definitive line between having empathy and lacking empathy. So if someone were to be labeled with psychopathy, and maybe the majority of clinicians that are experts in this area would agree with that, it's just a way of conceptualizing an individual and their problems that allows us to choose from evidence-based treatment models to address that problem with the hope of a certain outcome. And I say all this because there are people in my field and online and experts who will contend that psychopathy, antisocial, and possibly sociopathy cannot be changed. You can only mask the symptoms or help someone to not incur the consequences. For example, and I've done this kind of work, that you have someone that has antisocial or has been conceptualized as suffering from antisocial personality and or psychopathy. They lack empathy, and they've had a lot of personal consequences, which is typically the case. People with antisocial personality and people with psychopathic personality have typically a train wreck of a life. They are in and out of prison. They are exploiting people around them. They burn through relationships very quickly. They are manipulative and are seen as manipulative fairly quickly and are rejected because of it. And so they have problems. They get fired. They have money problems typically, which they will resort to mooching off of other people, being having a parasitic lifestyle as it's described. So their lives typically don't go well. And for a minority of these individuals, they might actually seek clinical treatment, or they might be recommended or even forced. And for these individuals, they might actually try to use therapy to their benefit. Now, they might not want to change their behavior really because they don't really care about other people's feelings, but they might want to figure out ways to stay out of trouble because they don't like getting in trouble all the time, and they don't like being constantly struggling with the consequences of their actions. And so they might seek out therapy, or they might use therapy effectively. And I've, again, done this kind of work where we're not going to cure them of their problem. We're not going to somehow develop empathy inside of them, or whatever it is that they need to develop that is underdeveloped or doesn't exist. But what we can do is to help them problem solve and help them understand other people and help them to understand how to stay out of trouble and help them understand how other people work, not with the effort of trying to manipulate those people, but with the effort of trying to predict other people's behavior and how they're going to react. Because, for some antisocial individuals, they don't know that other people can be as afraid as other people can be. I don't want to go down a rabbit hole on this, but anyway, the point is that it's possible that your friend is in that category. So that's one possibility. Another possibility is that this individual either had moderate psychopathy and antisocial personality and or sociopathy. So they were on a spectrum. They had some empathy, some capacity for empathy, but they did have a lifestyle or a way of interacting with the world that was more psychopathic. And when they were first being treated, they fit all the criteria. And with therapy, they were able to bolster that part of themselves that did have some primordial empathy. And maybe the empathy isn't as robust as others. And by the way, I've done a whole deep dive on empathy. And so I should define empathy, and I will define it as caring about other people's feelings, compassion, that kind of empathy, right? And so for these individuals, they are on the spectrum of psychopathy, and that amount of psychopathy has affected their lives negatively and those around them. They enter treatment, and they're able to capitalize on that part of them that does have the capacity for empathy. It could be argued that every psychopath has some shred of empathy that can be bolstered if the client actually is willing to work on that. So that's another possibility. The other possibility is your friend actually didn't have sociopathy or didn't have psychopathy, and that the clinician was wrong. The other possibility is that the clinician was using sociopathy in the way in which it is different from psychopathy and antisocial, which it is used sometimes in this way to refer to individuals that exhibit lack of empathy and lack of concern for rules and norms, but are doing so because they learned to do so due to their early environment or the environment they're in, like if they're in a violent, dangerous neighborhood, or they're in the midst of a war. So these individuals have fundamental empathy, and if they were left to their own devices and weren't affected by their environment, they would have developed normally. But they've had to resort to certain things, and you mentioning that his childhood was very difficult might have been conceptualized by the clinician as the reason why the individual has exhibited lack of empathy towards others. When I get into my eventual deep dive on psychopathy and sociopathy and antisocial, there are models that actually propose that all of these individuals have had horrendous early childhood experiences and are exhibiting lack of empathy and callous behavior and manipulation and possible sadism because they are trying to overcompensate for their pain and their lack of safety in the world, and that they've given up on humanity because of logical reasons, because of the way they're being treated. Anyway, so I'll just say that as an aside. Other people will contend that some people are just born antisocial. They're born with psychopathic traits, and if developmentally they aren't raised in a way that helps them, like they're, according to these individuals, they're born with with psychopathic tendencies, with a disposition of psychopathy, and if the parents are, let's say, a little below average, they're good enough, but they're not great, then there's a chance that individual will blossom into a full-blown psychopath because they aren't given enough reason to develop the understanding of other people's feelings because of the way they're being treated. You know what I'm saying? Okay. So that's another possibility. But I will say that I have treated people, and there is research. And did I say this? That this is a little bit rambly, but there are those in my field that will contend that once a psychopath, always a psychopath, and that you can't cure them. In fact, they will go so far to say to actually engage with them clinically is only to teach them another way to manipulate people. That if a therapist engages with a psychopath, at the very least, it's just going to be useless and a waste of time, but at worst could actually result in the client actually learning, I've learned some psychological things, or I now know how therapists operate so I can manipulate other therapists or that sort of thing. And should clinicians think about that? Yes, absolutely. I mean, psychopaths and people with antisocial personality, it's no joke. We don't have these labels to describe just a small problem. These individuals are big problems, and they cause a lot of problems, and clinicians who work with them need to be extremely careful. But there are those that believe that you cannot treat them once a psychopath, always psychopath. Other people will contend that you can help them, especially if a large part of their developmental psychopathy is related to trauma. If you treat the trauma and sort of start over with their development in some ways, then over time, the individual can capitalize on the kernel of empathy that's inside of them and expand that. It'll never expand to the degree that people who develop normally will develop into, but theory goes and hypotheses. And people will say on both sides of this debate that they have the evidence, but the fact is that it's really hard to measure this scientifically because, as I was saying earlier, even when we apply the label of psychopathy, it's unclear if we're actually pointing at something, or if we're pointing at the same thing, people will define it differently. And we just have to recognize that. And that's okay. It's not the end of the world. But we need to recognize that, and we shouldn't state things as fact about things that are squishy, like the constructs, especially things like psychopathy and antisocial, especially a client who is participating willingly in therapy and is trying to change, maybe for the benefit of their life and maybe the benefit of other people's lives. Because it's a bit of the way that the internet and some clinicians in my field, the way that they envision psychopaths, the way that they envision sociopaths and people with antisocial is a cartoon version. Now, does that cartoon version exist? Yes. But it's just one of the profiles of these individuals. There's a lot of profiles. Just because someone is a psychopath doesn't mean that you know who they are, meaning that, it's like tall people, right? Tall people, there's lots of kinds of tall people. You have extroverts and introverts. You have smart and not so smart. You have people who are into Dungeons and Dragons and people who are into cars. Tall people, we understand that, right? Well, psychopaths is the same. There's a lot of, every psychopath is different, but the general public and some clinicians, because they don't have experience with psychopaths, tend to have this cartoon, almost, comic book version of what a psychopath is. And yeah, those individuals, those psychopaths do exist. They're a minority, though. Psychopaths are a minority also. But and might one say that that profile isn't likely to change, isn't likely to recover, and wouldn't want to recover in therapy? Yeah, okay. But there's a lot of different guys. And if you're an expert in the field and you actually work with people like this, then you will know that. But I will say that if you are an expert in the field and you treat psychopaths, especially willing psychopaths, then you also have a bias because you've only seen the ones who actually want help. They have some semblance of care, at least intellectually. And that's what I've heard from psychopaths that are in therapy or are trying to change. They intellectually can understand that their behavior impacts other people and that harming others or not caring about other people's feelings is ethically wrong. But they don't have the same internal reactivity to other people. Hopefully most of humans have both. They both understand intellectually that it's not okay to harm others, but they also just have they can't stomach hurting other people, right? But with these kinds of psychopaths, they can very much stomach the suffering of others, but they can develop, independent of therapy, because I've seen this, they can develop the moral underpinnings of not harming others and doing good in the world. And for these people, they can obviously benefit from therapy. Now, for some, they might argue that's not a psychopath or that's not someone with antisocial personality. And again, there's no way to argue against that because it's all just squishy, subjective observations of people and definitions as well. So, Madi from Arizona, when you have a friend who says in the past they were diagnosed as a sociopath and they've been through a lot of therapy and they're no longer an asshole, that's his word, and you're like, what does that mean? Well, it could mean all the things that I said and hundreds of other possibilities. So, it's possible that he is faking that he cares, and he's not doing it to manipulate. He's doing it because he wants to fit in. He wants to benefit the world intellectually. He intellectually understands that he shouldn't harm other people, and so he's faking empathy. It's possible. There's another possibility that he has developed empathy and that he is that version of a developmental sociopath with a kernel or a foundation of empathy that was allowed to emerge once the traumas were addressed. Or he's one of those individuals who was on the spectrum, or he was misdiagnosed. Anyway, let's take a break and we get back more emails. All right, we're back from the break. This next email is from annual middle tier patron Ian from State College, Pennsylvania. He wrote in, by the way, State College, Pennsylvania, right? Isn't that where Penn State is? Which is where Bob went. He's talked about State College, Pennsylvania. Very descriptive town. Reading your email. Dear Dr. Honda and I'll just skip to the chase. I've read the email. Ian is asking for books, resources for his sister who gave birth to twins and is a single mother. And she is wondering how to be a good parent. So I don't have those kinds of resources off the top of my head or even written down, but I will tell you that John Gottman and Julie Gottman, their website, the Gottman Institute, has a lot of really great resources and classes and books and graphics and YouTube videos that are, I can say, very good resources for any parent or really just anybody. The focus on emotions and mirroring and helping kids to develop in that way is very important, and it's evidence-based. So that's what I would recommend. But there are there are so many resources out there. I would guess anecdotally that if you bought a book at Barnes & Noble, a bookstore on parenting, 9 times out of 10, it's going to be pretty good, and it's probably going to have a lot of overlap with other good resources. So there's that. And I'll reduce my advice down to one thing, which is to, 2 things. One thing. I'll do one thing. And it has to do with attunement, which is 2 things. So listen to my deep dives on attachment theory, which have to do with attunement and all the consequences of good and bad attunement. But attunement is 2 things. One is paying attention sufficiently, enough of the time, to the emotional and just thought state of your child. So the emotional state like sadness and joy and boredom and frustration and discomfort and distress. So paying attention, but also just to what you imagine the kid might be thinking, like they want a cookie or they like a friend or something. So you're paying attention to the inner world of the child. The second thing involved in attunement is reacting well to what you are observing. So an example would be, you have a kid who's grumpy. It's nap time and they haven't taken a nap, and you haven't had an opportunity to get them a nap. You're doing errands or something, and they're annoying you. And so you take a beat, and instead of just reacting like, "Hey, we're not going to do that today," or whatever, you take a beat and you say, "Oh, so are you feeling grumpy right now?" Now, you might be wrong. 1, 2, the kid might not know if they're grumpy, and or the kid might not want to admit that they're grumpy. But it's possible, and every situation is different. The magic of parenting is mysterious and poetic and glorious and horrible. But the example that I'm giving might be an example of good attunement in that you might be guessing at least somewhat right that the kid is grumpy, and you're not barking at them. You're seeing them, and there's care in your voice. You're not ridiculing, you're not criticizing, you're not upset, but you're also not like celebrating that they're grumpy. You're observing, you're with them, you see them, and you care to see them, you care enough to notice, you care enough not to overreact. Oh, are you grumpy today? I don't know. It seems like what you're doing is what I do when I'm grumpy. I feel grumpy sometimes too. Having that at least some of the time. It's not all the time. There's no way to do that all the time. And parents out there that might be thinking, "Oh my God, I don't do that very often." That's okay. And plus, there are ways to do this in a very effective way, but in a way that from the outside it wouldn't look like that. I gave an example of a very overt attunement action, but you can attune to a child without even saying anything. It's just a way of looking at the child, or a way of just sitting with the child. Like the kid is really into their video game. They're 13, and you're walking through the room, and you just stop, and you just kind of watch them play the video game, and you're like, "Whoa, that was exciting." And then you walk out of the room. That can be attunement too. Attunement is a feeling, it's a communication, it's a vibe. It's not like this prescriptive script that you follow. Having said that, when you learn the prescriptive script, particularly with young kids, it can really be helpful, especially when you're frustrated. When you're like, what's that? At the very least, to start off with, okay, attune. What's the emotion? And how can I? It's also a matter of differentiation, because you have to pull yourself out of the fusion a little bit and say, okay, I have to observe. I have to be the adult here. So, that's my advice. Let's take a break and we get back more emails. All right, we're back from the break. Another email here. Long-term anonymous patron. She says, Hi, Dr. Kirk. I am a school counselor turned college academic advisor, and my plan next year is to get started on my PhD in counselor education. Thanks so much for the podcast, as it has inspired me to pursue my career. It's inspired me to pursue a career in counseling and get a PhD. Okay. So I'm kind of rewording things to keep it anonymous. Anyway, I also have type 1 diabetes as well as chronic migraines. I work really hard at keeping both under control, but it is still a challenge. When I have a migraine at work, I really struggle to counsel my students as even small head movements really hurt my head. Just chiming in. Yeah, that sounds rough. Migraines are the worst, just the worst. Going on. With type 1 diabetes, when my blood sugar is low, my phone will beep. I then have to take a sip of juice right away to bring my blood sugar back up. And I also may find myself sleepy and struggling to make sense when I speak if it is low enough, if my blood sugar is low enough. The sip of juice is something that needs to happen right away during a session. This happens maybe a couple of times a week on average. Since my goal is to transition over to more clinical counseling, how would you recommend I handle my health issues with clients? I spoke to my therapist about this, and she laughed and said, "No one will even notice," which is fine. My therapist is awesome, but I'm still worried about it, LOL. I am worried that my clients will think I'm distracted, and my biggest fear is that they will feel unheard if I am not at my 100%. Let me know your thoughts, and thank you for everything. End of email, smiley face. Yeah, end of email. So the short answer I will say is that if I were you, would just tell my clients as soon as I had an appropriate time, which could be like right away, that this is what's going on. Let me role play something that's like you're going over the initial paperwork, which usually takes a little bit of time. So there's always some kind of formality to that. And in that, I might say, and by the way, I just want to tell you, as I tell all my clients, that I suffer from migraines occasionally, and I have type 1 diabetes. And what that means is that in session, occasionally, I will get a notification from my phone telling me that I need to take a sip of some juice. It's not an emergency. If that ever happens in a session, just know that I'm not randomly sipping on juice because I'm like a sipper. It's done on purpose. And know that I'm totally fine. And if things get out of control for me, I will stop the session and reschedule with you. Also, at times, I suffer from migraines. And I'll tell you that if it's real low grade, like it's, like a 10% migraine, or I feel one coming on or I'm worried about one coming on, I'm totally fine. It's just the little tingling that I feel. But if my migraine gets to a certain point, I'll tell you that I will stop the session and have to reschedule, because once a migraine kicks in, it doesn't usually go away for a while. So I apologize in advance if that ever happens. I'll tell you that that kind of thing is unlikely to happen with us, but I just want to tell you in advance if that ever happened. Okay. So, you say that. Most clients are going to be like, okay, it's fine. Some clients might say, oh, I have migraines too, or I have diabetes too, or I have a chronic medical condition. Thank you so much for disclosing that and modeling that you don't have to say, this applies to all sorts of things. Some people suffer from lower back pain or sleepiness for that matter. And what I tell my supervisees is, it doesn't do anyone any good to grin and bear it, because the client will, if things get out of control, like you start falling asleep in session, or the look on your face is reacting to the sharp pain in your lower back, or you're distracted for that matter, your client will at the very least detect that, and that is potentially interpreted by the client like you don't care, or that you think that what they're saying is painful to your ears or something. So is that, yeah. And I think in any other context I don't think people would have a question about this, right? Like if you were, I don't know, like a waiter at a restaurant and you're about to be hired at a new restaurant, you're like, well, I have diabetes and I have migraines. I don't think many people would say, well, what do I do when I have a migraine and I have a customer that wants to order food? I think most people would say, well, if I have a migraine, I probably can't work, unfortunately, or I have to tell the customers, by the way, I'm suffering from a migraine, so I might not be super nice right now, and I just want to apologize for that. But I'll definitely take your order and I'll pass along to the. Somehow I think that therapists have to be this constant beacon of stability and health and availability and listening and stuff. And but that doesn't mean denying reality. Most people, most therapists have things occasionally. It could be even something really brief, like you're going through a divorce or your mom died earlier that day and you don't know what to do. Now, I'm not saying you're supposed to power through a session or you're supposed to tell your clients about everything, but you're allowed to be human. You're allowed to have things. And sometimes, especially something like this, if you predict that for the near future and maybe the rest of your life, there's always going to be these issues, then, just tell your clients and be okay with it. Maybe role play how you would say it and maybe role play how you would respond to questions. Some clients, I would imagine most clients would just be like, okay, thanks for letting me know. And they're not going to get uptight about anything, even if you were to, in the middle of a session, say, it's one of those times I'm having a migraine, we're going to have to reschedule. But some clients might have some weird questions, like, tell me more, or they might become overly concerned about your health and your feelings because that's engaging their issue, which is a wonderful opportunity in therapy to start looking at that with the client. So that's my answer to that. All right, this next email is from annual middle tier long-term anonymous patron and YouTube member. She has an email here, and I'll just summarize it. She is wondering, she suffers from schizoid personality disorder, and she's starting to notice that one of her kids might also be developing into having schizoid personality disorder. So she's wondering, can someone with schizoid personality disorder condition their child to also have schizoid personality? And the answer is yes, absolutely. And I don't have the research in front of me, but anecdotally or hypothetically, given my conceptualization and other experts' conceptualization of schizoid, there would be a risk of having a child with schizoid if one of the parents has schizoid. So to review schizoid, in a nutshell, these individuals tend to have relational traumas from 0 to 5 that are characterized by extreme neglect. Now, the parents might be there for needs of food and shelter and that sort of thing, but not interactions or mirroring or emotions or socializing, this kind of thing. And there might also be fear that the child is experiencing such that they need to turn away. The result of the environment socially is such that the child very early on neurologically turns away from other people and turns away from their emotions. They have emotions and they do want to be with others, but they cannot tolerate even the notion of needing that or wanting that when they are very, very young. Like I said, as young as 6 months old or 12 months old. So as an adult, they have a really hard time identifying with that inner desire to connect or to be with other people. There's a lot of other ancillary symptoms that I'm not getting into, but the point is that that's the central feature. That's the feature that is common for everyone with schizoid. And as a result, you can imagine as a parent, if you present to your child, if you parent in a way and model and also react to your children in a way that is blunted emotionally, even though you care and maybe you've even recovered to some extent, but you still have some of the traits, then that can be experienced by the child as neglect, which can result in that child needing to turn away. But I will say, given your entire email, which I'm not reading aloud here just for time's sake, it is not a slam dunk indication that your child does have schizoid personality. There's a reason why we don't diagnose children with personality disorders, and a big reason is because it's just hard to tell. Kids go through phases, and also kids aren't the best reporters of their inner experience, and so it's hard to tell. There's a pretty good chance that what you're observing is something else, or they're just a little quieter or a little bit more aloof than your other kids or something. So it's just hard to say. But it is a worthy question, and the larger question that I imagine you have thought about is how, and everyone needs to think about this, is how do my relational traumas affect the way that I parent and the way that I interpret my children's behavior and the way that I tend to operate, day by day with caregiving actions and impulses. Every parent will experience that moment where they say, oh my God, I'm acting like my mom, or I'm acting like my dad, or I'm doing that thing that happened to me. At the very least, I would say I hope every parent has that realization, because there are many parents that won't have that realization, even though they are reenacting the mistreatment, however minimal. Everybody goes through some mistreatment growing up, if we define mistreatment fairly liberally. And there's no way around not reenacting that. Plus, just the stress of parenting, even if you went through zero mistreatment as a child, even in the broadest sense, which is impossible, parenting is complicated. There's some situations where there's no way to win. Anyway, so that's my answer to that question. All right, this next email is from annual patron and YouTube member Hannah from London, UK. She says, I have been dating my partner for 2 months and have had one of the most amazing and supportive relationships of my life with him. My one concern is that he has a particular taste for Andrew Tate's videos. He listens to Tate brag about his wealth and uses cringy language to describe self-discipline. He says, and it is clear from our relationship, that he does not support Tate's misogynist view of women, but I still find it all a bit weird. Normally, I would take the Tate videos as a huge red flag, but the guy I'm dating is a really kind and sensitive person, and I wonder if there is something he gains from seeing Tate's grandiosity. I know he finds supporting his mother financially challenging and might use these videos to drive a sense of purpose in a weird way. Always interested in your views on positive and toxic masculinity and why men seek out these figures for various reasons. I could ask him to stop watching these videos, but if he's gaining something from them, then I don't know what to do. End of email. Yeah. It's a really great question. I get this question a lot, actually, and I see a lot of people having these kinds of conversations online. And if you actually watch, which, I don't recommend anyone do necessarily, but take it from me as someone who has done a little bit of this. If you actually watch the videos of Andrew Tate, not the sensational ones, not the ones that get tweeted, but if you actually just watch the regular day-to-day content that Andrew Tate makes and the regular, day-to-day content that someone like Jordan Peterson makes, there's a lot in there that's really run-of-the-mill. It's not anything sensational. It's not even unique. It's general advice that you'll get anywhere, maybe even advice that you would get from me. So a lot can be said about that, meaning that you can have someone, particularly the way you put it is that you say normally, he says that he does not support Andrew Tate's misogynist views of women. So right there is, I imagine, the main concern for you, Hannah. And, maybe ask him, can you show me a video of his that and why that you like and maybe why you like it? Because, and I can relate to this, that if I was left to my own devices and I didn't think critically about my own impulses, if I heard, if I was dating someone and they were into Jordan Peterson or Andrew Tate or even, dare I say, Donald Trump, then I would immediately, without question, drop them. I would stand up from the dinner, if we're out at dinner on the date or coffee or something. I would be like, oh, well, then we're done. And I would stand up and walk out. But that is ridiculous. So I can relate. I understand that impulse of just like, wait, what? How can you be a good partner? How can our relationship be good? And you watch Andrew Tate videos. But I know enough to know that if you actually look at what they're saying, also there's a real lack of mentoring and of guidance and of inspiration that is not along these lines for men. Maybe an analogy for women would be, I don't want to name any names, but there are some women influencers that if you're not on the inner circle, if you're not consuming the content that influencer is making, from the outside, it would look like you're some kind of unsophisticated, brainwashed individual to consume that content, because from the outside, the content looks a certain way. I'm trying to think of an example. I don't know why, but like the TV show Sex and the City popped into mind. It's not a show that I've watched. And I know enough to know that people who don't watch it will think that the show is atrocious and that anyone watches it, or something like the Kardashians or something, or reality TV. There are cartoon versions of this content from the outside, right? People that aren't on that inner circle would judge people that love the Kardashians or love 90 Day Fiance or something like that. But when you actually, get into the inner circle, you're like, well, yeah, I mean, there are some ridiculous things, but there's also some redeeming things. It's, it's entertaining. So, when you actually get into the Andrew Tate world, which again, I'm not recommending, but it's not wall-to-wall misogyny and crime and horrificness. It's a lot of inspirational stuff, and to some people it really resonates. Stuff like, hey, you got to pick yourself up by your bootstraps, and you've got to get out there and stop making excuses, and you've got to get control of your finances, and you got to start providing. And maybe there's traditional masculinity and problematic stuff sprinkled in there, but hopefully your partner can sift through that. We all have to do that. I'm sure some of you have to do that with me. I'm sure that when you can, I say a lot of shit. There's no way that everything I say is completely on the up and up with everybody. So, and could you take snippets of what I have said and have that be what everyone, non-fans think all that I'm saying, and from the outside, I look like a complete fool, and anybody would be a fool to watch my videos or listen to my podcast. Yeah, that can happen. So, any figure like Andrew Tate or Jordan Peterson or Donald Trump who has that many followers, by definition, their content must not be wall-to-wall horrificness, because all of those millions of people, a smattering of them would be attracted to a horrific person, but the vast majority of them would not, right? So there must be something redeeming. That's what I think. That I'm not saying that's true. I'm not saying you're supposed to think that. Now, all this to say, is it an option for you to say to him, hey, you say you're not a misogynist, but I'm a little concerned. So can you reassure me that, because I can't imagine someone that I love even tolerating Andrew Tate. So can you somehow help me out with this? You can certainly ask for that, some reassurance, some conversation about it. There's a chance that Andrew Tate has led him astray somewhat, right? And some amount of corrective action or de-brainwashing might benefit the two of you, but particularly him, but also your relationship and you. So, yeah, that's what I'll say to that. All right, this next email is from long-term patron Anna from West Wiesbaden, Weisbaden or Weisbaden. She says, others have told me that my mother was really impatient. Others have told me that my mother was really impatient. I have been in therapy for quite some years now, but I just realized that my impatience at work might have something to do with my mother. I have learned that situations which give me this amount of emotions and stress often have some deeper cause than just annoyance. What is impatience? Where does it come from? And most importantly, could it be my mother again? Best regards, Anna. End of email. Well, impatience is a very complicated thing, and it refers to a lot of different things. Impatience, as an observation of the self or of another person, often is the result of a long flow chart that led to impatience, right? So you have the word annoyance in here because, not all impatience has to do with annoyance. And I am impatient. I've talked about that before as well. And I don't know if I've ever really explored it on air before, my own impatience. But I think my impatience has to do with a number of things, some neutral and some negative. On the neutral side, I think that as part of my mild OCPD or just part of my drive to do things in life, whether it be work-related or fun-related or experience-related, I'm one of those people that I don't like being bored, and I like to have experiences, and I like to do things. I want stimulation. So maybe that's another possible factor in impatience is just a need for stimulation, not necessarily related to ADHD, but could be. But that's not how I'm referring to it. Just there's a character trait, a personality trait that we often will say need for stimulation, and that can be a problem. Obviously, like in a psychopath, it leads to them using a lot of substances or trying to harm other people or something. But for myself, it's just this. But for me, I think it's related to drive as well. I only have so many days left on this planet. I've known that since I was a teenager. I don't think I'm going to die tomorrow, but I know that time goes fast, and I know it's limited, and I don't want to waste my time. I want to do stuff. I want to accomplish things. I want to have experiences. I want to have I want to have relationships. I don't want life to pass me by, and so if something is getting in the way of that, or someone's wasting my time, or something is wasting my time, then I will exhibit impatience from that, right? So whatever you want to call that, right? And could I be annoyed? I suppose, but that's not really the feeling that I'm having. It's more just like, look, we're all limited in time, and so let's get to it. Another instance of impatience for me, and I talked about this in a recent episode, how I hate emails at work that don't get to the point. Now, that's how I would describe it. I think other people would describe it as like a friendly email that has a little bit of fluff in there, like, hey, how you doing? My weekend was, whatever. And I recently discovered that I have dyslexia, or at least significant dyslexia, because before I knew I might have a little bit of it, but more recently I'm like, wow, there's so many different signs. I don't have significant dyslexia. I would put myself in the moderate range, maybe even minimal range, depending. But it manifests in that reading is tough. It requires a lot of effort, a lot more effort than other people, and I read slowly. So when I get a long email that is trying to inform me about something, but it's not getting to the point, it's a lot more taxing for me. It also engages in my shame about not being able to read fast. I might have to read it several times because I'm not really tracking, I'm not comprehending, especially if it's in the midst of a lot of other emails. And so I will just not read. Over time, at the university, I just stopped reading. If they didn't get to the point in the first couple sentences, I would just archive the email immediately and not read the rest. From the outside, that's impatience, right? But from the inside, it's dyslexia. It's, I suppose, maybe shame related or it's energy related. If I actually read every email and all the fluff, I would have no more brain power for anything else. I wouldn't be able to teach classes. I wouldn't be able to talk to, because it would require so much brain energy to pay attention to that. I mean, I might be exaggerating a little bit, but it's along those lines. So that's another manifestation of impatience, right? So when you describe impatience, Anna, you're saying that your mother was really impatient, and you realize that you're impatient at work, and that at work you get annoyed, which results in impatience. So, but your question, so, it could be a lot of different things involved in impatience. There's even, anyway, so that's what I'll say about that. But your question is, where does it come from? And could it be your mother? Yeah, your mother could have modeled that for you. You could have internalized those notions. Think about schemas, right? So I don't know, but one scenario is your mother was really impatient in general, but also with you directly, and say she asks you a question like, how was your day at school today? And you're like, oh, well, I don't know. I went, I had a math test, and your mom gets impatient. I don't know if this is what the impatient was, but let's imagine. And your mom's like, oh, get to the point. Your stories are so boring. If you don't have something to say quickly, don't say anything at all, or whatever. Okay. So we would call that impatience, maybe from the outside. We also call it being a dick, but some people might call that impatience. And everyone in the family might call that impatience. You might call that impatience. And so let's, in that scenario, you are being shown the world, and you're developing a schema that you are too slow, or you stammer too much, or you don't commit fast enough. Okay. So you are learning that unless you really try hard to be quick about things, then unsafety is going to happen to you. Okay. So you have to have some way of coping with that. There's surrender, avoid, and overcompensate. One could overcompensate by being extremely concise and brief and to the point, and never waste anyone's time, and also require that no one wastes your time. You know what I mean? So that's just one pathway to the schema of overcompensation. So that, again, that's a way of having a parent who is impatient, quote unquote, and resulting and that results in you being impatient. But when you describe it more thoroughly, impatience is just one of the words that you would describe, because there's a lot of different pathways, a lot of different things that are happening. Anyway, let's read another email. All right, let's just do one more email. This is from another Seattle therapist, is how they want to be referred to. So an anonymous Seattle therapist. And he wrote a longer email talking about how in today's world, you have a lot of teenagers that are diagnosing themselves after watching TikTok videos. And they're coming into therapy, and not only are they misdiagnosing and confused about what disorders are, but they're also heavily identifying with the diagnosis. And they're asking, what to do about that. And it's complicated. Every client's different. It depends on the disorder. And I've even 25 years ago, I would experience this, before TikTok. And, although for us clinicians, it might be like fingernails on a chalkboard to hear people bastardizing our terms and our language and leaning into it in this very strange way. So it might have that effect on us, but we have to ask ourselves, is it relevant to the therapy? If I had a client, let's just say, I have a 16-year-old client who is absolutely convinced that they have autism. They are on the autism spectrum, and they also have ADHD. These are very common things that are talked about on TikTok. And I do some assessment, and I don't tell the client this, but I do not diagnose them with autism spectrum or with ADHD. Well, what's the goal of therapy? What are they there for? If they're there to, quote unquote, get treatment for those disorders, but they're not really there to work on something that's real, then I would tell them, I don't know what I'd tell them, but, case by case, but I would try to figure out a way to stop treating them because they're faking or they're confused or something. But let's say that they believe they're on the autism spectrum and they have ADHD, but I don't think that, but they're in therapy because of low self-esteem, or they're in therapy because they're having troubles in school or with their parents, or they're confused and they don't know what direction to go in their life, or they feel lonely, or they're depressed or something. And they frame their depression as a part of their autism spectrum or their ADHD or both, or a cause or causal of, their ADHD and autism spectrum causes the depression. And all of their language is around that. It doesn't really matter to me as a therapist because the end result is the same, and the treatment isn't really affected by that. I'm going to do the treatment, and I might even outwardly agree. I might even say, okay, yeah, you're right. That might be because of your ADHD, because of this and that. But as long as we're getting down the road, because with most clients in that scenario, not all, I would imagine that engaging in a deprogramming conversation with the client risks alienating them. And at what end? What's the what do I care? The thing that I will say is that there's a positive silver lining here, which is that you have people, including young people today, that even know about these things. And it's not, the way that I would look at it in this scenario that I laid out, and I've been there before, is that there, let's say there are two different options as a therapist. We can choose between two different scenarios where you have a bunch of 16-year-olds that have never heard of anything in the DSM, and they have no knowledge of any of that. They don't know about trauma. They don't know about personality. They don't know about any of that. Or on the other hand, you have people that know some and are, vastly uneducated about it and are making conclusions that are wrong. Again, it depends, but I would rather have door number two, because at least they're aware of the concept of trauma. They're aware of the concept of personality traits. They're aware of the concept of having neurodivergence or differences in, like if I did not think that someone was neurodivergent, but, at the core of the matter, they're acknowledging that there's something about them that, makes them different from other people, or makes it hard for them to do certain things, or gives, there's pros and cons. I would zero in on the pros and cons that are real, right? Whether we call it ADHD or autism spectrum or not, it doesn't really matter. What are they there to work on, right? So that's my answer to that. It's all right. This last email is from middle tier patron Nadine, and she has a longer email here that I'll put aside for now and maybe answer with Bob at some point. But at the end of the email, you ask a lighthearted question that I can answer lightheartedly, because that's what I want to do at the end here. You say, I was wondering if you have any music recommendations. A couple of years ago, you mentioned The Strokes was your favorite band, and they ended up being one of my favorites too. End of question. Yeah. So I don't know if people care to listen to an old man's recommendations of music, but here we go. So I'm just looking at my Spotify. I tend to make playlists of artists that I really like. Band of Horses. There's especially this one album called Everything All in Time or Infinite Arms, both of those albums. But also Cease to Begin is a really good, anyway. So there's that. Cat Stevens has some great songs. It's an acquired taste, I think, for many. Nick Drake, but really it's one album, and that's Pink Moon by Nick Drake. His other albums, to me, really just don't hit me even close to the way that Pink Moon does. Wall to wall, that album is just perfection. Elliott Smith in a very similar way, but pretty much everything from Elliott Smith before he died. There's a posthumous album that they released that is hit or miss, but the albums, the 5-ish albums that he released while he was alive, to me, there are, if I had to pick 3 music artists, it would be the Beatles, the Strokes, and Elliott Smith. I could go on and on about why, but I won't. The Shins is another band that you'd probably predict that I would like. But their first few albums are just perfection, wall to wall. Who else? I mean, I have a George Michael playlist. There's some really great stuff in there too. I mean, I tend to like the stuff that he had mid-career, like in the late 80s. You know, songs like I Want Your Sex and stuff like that, it's like, yeah, whatever. But other songs like, you know, Freedom 90 or Careless Whisper, but even stuff with Wham, right? Club Tropicana, Young Guns. Other bands, ELO is one of my favorite. There's a lot of ELO songs I love. Elvis Costello. There's a certain period of time and early career that I just cannot get enough of, especially his album Punch the Clock, but also the album Spike, which was later, but that's another great album. The Police. I'm trying to think, if you liked The Strokes, The Police, maybe you'd like The Police. The Cars, The Smiths, Led Zeppelin, Stevie Wonder, especially 3 albums, which is Talking Book, Inner Visions, and Music of My Mind. Those 3 albums are perfection. Radiohead, Tears for Fears, First Aid Kit, The Cardigans. People know the Cardigans from that one song, you know, Love Me, Love Me. But that is, I hate that song. But every other song that they have is, I think, pop perfection. MGMT is another band that I love. Let's see, The Strokes. I'm trying to think of other bands like The Strokes that I could recommend. The Once soundtrack, nothing like The Strokes. I'll go. So I have a favorite playlist. Robin is on there. Roykskop, Michael Jackson, The Strokes, MGMT, First Aid Kit, Band of Horses, Level 42, Rush, Depeche Mode, Tegan and Sara, Elvis Costello, Interpol. Interpol is a band that, if you like The Strokes, listen to the first few Interpol albums. I like Gnarls Barkley. I know it's, you know, what's his face? There's some problem there, but that St. Elsewhere album is a banger. Good Shoes. Okay, so if you like The Strokes, Good Shoes, an obscure UK band that I think should have been big. It's a band called Good Shoes. Their album, which is wall-to-wall perfection, is Think Before You Speak. It's just perfect. Tame Impala, Shins, Nick Drake, Posies from back in the day, Band of Horses, Fleetwood Mac, The Knife, Joe Jackson, Phoenix, some early Genesis, Ghostland Observatory, Smiths, Queens of the Stone Age, Buzzcocks, Julian Casablancas. So if you like The Strokes, you'll like Julian Casablancas. You probably wouldn't like his side project, which I'm forgetting even the name of, but he had a solo album, which is very Strokesy. Steely Dan, Mazzy Star, Pumpkins, Rogue Wave, The Knack, Nick Kershaw, Cat Stevens, Radio Department. You might like Radio Department if you liked The Strokes. The Byrds, Rod Stewart, Robert Palmer, some mid-career Robert Palmer before he like Johnny and Mary is one of my favorite songs. Beach Boys, Paul McCartney, Blur, Chicago, the band, Elliott Smith, Dinosaur Jr. You might like Built to Spill, Journey. Anyway, boy, that does it for that episode, in which I just named a bunch of bands that I like, and don't judge me if I like that stuff. Ben Folds 5, another great one. Sunday Day Real Estate. Anyway, everyone, please take care of yourself because you deserve it. You really, really do.